As you're logging in, if you wouldn't mind going into the chat function at the bottom, the cartoon bubble, and add your name and your email address. That helps us with managing any follow-up questions or making sure that you have an invite to our next event.
Lori, my chat says chat disabled. Is that something you have to do, or did I do something wrong?
Nope, that might be our end. Nathan or Renee, can you tweak it from your end?
If you make me a co-host, I can give it a shot. And that's just by clicking the dots up by my name.
Got it.
Okay, it should be good now.
Thank you. Give it a try. Check out the chat. See if the bubble opens now.
It opens now.
Excellent. Thank you. Well, good morning, everyone. Happy March 27th, Saturday morning. I appreciate everyone who is up and joining in this conversation. Got some hot topics to talk about, and then we'll open it up to the crowd to address. Coming off of a busy first quarter in Lansing, the hot topic was healthcare. We had a huge package of bills. I think it was around 15 or 16 bills that are intended to make a difference on prescription affordability. And these bills have been introduced and worked on for about 4 years now, 2 terms, the past 2 terms. I was on Health Policy Committee last term and this term, and so I've kind of watched them evolve. This term, when they were introduced, they were a priority for the Speaker of the House. They address everything from insulin affordability to contact lenses, telehealth, to general telehealth, pharmacy benefit managers, prescription, oral chemotherapy parity, and a whole lot more. So I'm excited about this because it takes a holistic approach, and it asks that pretty much providers at every level take some ownership over what they contribute to that price. All the bills were passed out of the House. They are now in the Senate. So if any of these bills are of particular interest to you, I strongly advocate reaching out to the Senate Majority Leader, Mike Shirkey. He sets the agenda for the Senate, what's taken up, how timely it's taken up, what gets a committee hearing. I also recommend reaching out to the committee chairs in the Senate for health. I don't have those offhand, but I can get those to let them know that you want a hearing on these. And also let your representatives know your position on them. So most of them I supported, but I did have a couple that I have some hesitancies on, and I'll share those. I had the opportunity to speak to insulin on the floor, House of the Floor House, in regards to this bill, supporting it. I have loved ones and friends and community members who are insulin dependent, and the cost of producing insulin is under $10. So when people have to pay $300 and $600 or more for a vial of insulin that they might go through one a week, one every other week, it becomes problematic. So this would cap the price at $50 per prescription per month. and it would make a huge difference. So I'm excited about this. I think it has traction. Like I said, it's been introduced before and it has been allowed to die without being passed out. There is pushback from insurance companies saying that this will make it unaffordable. However, other states have passed insulin affordability, and it has increased insurance premiums by, less than $1 a month. So it is, it's a big difference. We know people are foregoing using their insulin or going to other countries to get insulin in order to have that. Another bill that I worked on was oral chemotherapy as a volunteer with American Cancer Society. So right now, if you get intravenous chemotherapy where you go in and to a center, you have it administered, it might take 8 hours. IV chemotherapy can be much more impactful on body systems versus oral chemotherapy, which is often tailored to whatever cancer, where it's located, and it's how it's attacked. So oral chemotherapy is considered under the pharmaceutical benefit of your health insurance, and it is only covered at about 20 to 30% versus a medical service, which is considered covered at 70 to 80%. So these are, it's kind of arbitrary how it falls into whether it's a pharmaceutical or a medical service. And it should be covered. So you shouldn't have to choose. For people who are opting for oral chemotherapy, being able to take a pill at home, which allows them to continue with work and go about their life, sometimes with fewer side effects. We had testimony from a current representative who has seen the dramatic difference between an IV chemotherapy and an oral chemotherapy, and also having to pay $7,000 a month in order to get the treatments she needed in order to have it. So any support you can have to help push this through on the Senate side, I appreciate that. When it comes to telehealth, there's two bills. One is the ability to renew a contact prescription for up to 5 years with a telehealth visit. Listening to the ophthalmologist, the fact that when you go into an ophthalmologist and you have a screening, a lot of what they can catch on your anatomy is things that you don't feel. You don't feel pain, you don't feel discomfort. And so whether it is a tumor or blood sugar, they could identify diabetes. High blood pressure are all things that they can detect, not to mention, cataracts and glaucoma. And if you are just holding your cell phone up at 10 feet away, trying to read an eye chart to see if your eyes have changed, I question the integrity of that system. And so while it might feel expedient to renew a prescription, my question is, what is the quality of care guarantee and protection for patients? And what happens when something develops and it isn't caught through this process? So that was a bill I was a no on. It did get a majority vote through, and it will get more scrutiny in the Senate. The other one is being able to opt for telehealth services from other states. And while it's something that I heard for, people who might go south for the winter, being able to stay in touch with their physicians or psychiatrists, the issue lies in not being able to verify the licensure of a doctor that you're availing yourself health-wise of over the internet. And then also questioning if this is inclusive for all medical practices, what does this look like for a dentist that's doing telehealth? So it wasn't something that they were able to answer all my questions, and I was a no on. Again, it will get more scrutiny in the Senate, and we'll see where it comes out. I support being able to continue using telehealth within your state with your personal physicians, and I support that they should be reimbursed for those consultations that they're providing. That is not what this bill is about. And then it gets pretty complicated with things that are in your insurance, like the gag law. You may have heard on the news about restrictions on pharmacies being able to provide you, cheaper options for a prescription, or if you go to this pharmacy, you're going to get it at a better rate, often referred to as a gag clause. And there is a bill in this package, which I supported, that provides that those kind of clauses cannot be included into any pharmacy like contracts. And so you can have a frank conversation with your pharmacist, and they can give you a complete picture of what's out there, what's available, what's comparable, and what's affordable without obstructions. Right now, or in the past, it's been about you had to ask, you had to prompt it in order to allow that. They could not offer that up independently. And then we have these things called pharmacy benefit managers. They work with insurance plans or organizations that provide insurance for their employees, and they negotiate the price between the manufacturers or providers and the pharmacists. And it's a pretty complex formula of, how they decide what that price is. There's not a great deal of transparency about what prices are, or why we pay 8 and 10 times what other countries pay for their pharmaceuticals. So there's bills in there that regulate those, make sure that they're licensed. So if you're looking for more information on these bills, or you're looking to support them and continue activism on those, please reach out. Next up, COVID-19. So I am on the executive calls updates weekly on Tuesday evenings with the governor and her department heads to get the data updates from the epidemiologists through the Department of Health and Human Services. And I've been doing this for months. In addition, I sit on a couple other calls when there's an emergency change or an epidemic order. They bring in one Republican, one Dem from the House, one Republican, one Dem from the Senate, just to kind of give us a heads up of what's coming. And so we can flag what are some potential complications, or what should be considered when they roll these out. And it gives me an opportunity to voice concerns for our community on how these epidemic orders impact these changes. And, I've watched as we've gone through the second wave. It was huge. It was impactful. We tailored our behavior during Thanksgiving, during Christmas, and we brought those numbers back down. And by the beginning of February, we were down to where we were before October. And so that means relatively low. And we're starting to talk about opening up. We started looking at rolling back restrictions on restaurants and other public venues. As the weather gets nice, as we roll out vaccines, there's a lot of factors that allow us to open up. We also have a couple factors of concerns. So we have variants that are more transmissible, and Michigan has the second highest rate in the nation for these variants. And while we had brought our numbers down and we were hoping that we could keep them down, we're seeing another wave building, another spike forming. And they're very concerning. On top of that, my additional concerns looking at behaviors is a lot of families being on spring break, observing holidays like Easter and Passover, which might bring families together for meals and celebrations. And we already know that there's a 2-week lag on from when you're infected to when it manifests to when it builds severity that you need hospitalization, and then ultimately to mortality or death. And as we see these numbers go up, we're seeing hospitalizations increase, and just interesting things like where our 60 plus, 70 plus most vulnerable population was the majority of those hospitalizations on the past wave, and the majority of mortality. That now it's the 50 to 60, 50 plus crowd, because a significant portion of those 60 plus crowd have received their vaccination. So we're seeing population shifts within the transmission rates. And we're seeing with back to school, the kids are contracting and transmitting COVID-19. So my ask is that even with the holidays, that even with spring break and time off and away from school and home, that we're mindful of community exposure, that we continue to wear our masks, continue to practice safe distancing. If and when you get together, find places that are outdoors, well ventilated, and practice those things that keep us safe. Continue to minimize your exposure and risk, and do preventative testing screenings. So even if you feel healthy and you don't know of any exposure, anyone in your group who has contracted COVID, COVID testing is still free and open to the public. And what that does is help us catch asymptomatic spread. When you feel fine, but you're carrying a virus that has a potential to spread to others. So make sure you avail yourself of those as frequently as necessary. And then self-isolate, self-quarantine when you know that there's potential that you've been exposed, and the potential to transmit it to others. I know that we want opportunities. We want kids to have graduations and parties and proms. But if our numbers continue to go up, if we continue to expand our variants here in Michigan, this is concerning about what public opportunities we'll have going forward if our numbers continue. And Macomb County particularly is helping to lead the state in some of these transmission rates. So it's so important that this is not something that's happening somewhere else, that this is something that is happening in our community, and we can help prevent. Our behaviors, our choices have an impact on the spread. We continue to work on behalf of unemployment. We know that in the newest COVID relief package that there are extended benefits, and we're still watching to see how those go into effect, but we are still addressing the changes to unemployment in Michigan that once it was signed in was it January or February, the package from December, that they're still being implemented, and we're seeing increased asks for assistance. But unemployment has more accessibility. You can appeal directly to them, ask them for assistance with a call to their phone banks, an appeal on your MyWham account. We are there to help advocate when your case gets stuck or you're not getting a response from unemployment, a week or 2 weeks out. Please reach out to us. We continue to advocate, but we encourage that first make your asks from your MyWham account let them know that there is a problem, give them an opportunity to reach out to you to resolve that. Also calls to the hotline and setting up an appointment. Well, we can advocate for you. We don't actually resolve it. We are just putting pressure on them to get to your case. And so getting someone who has decision-making authority and or can solve some of those account problems is the first and best approach. Just to wrap up with, we did a diversity toy drive. We helped support Beaumont Child Life Specialists, and we had fantastic support. They received over 250 contributions of books and toys and games and puzzles and dolls. And they were thrilled to receive those and to be able to offer those to patients. So thank you. I'm trying to think what else is going on in the legislature. Right now, we have 2 weeks without session. That means no committees, no floor votes, and our office is refocusing on policy rollouts. There's issues that we're looking to tackle. We've been advocating solutions to standardized testing. You know, our students have been under a lot of stress and anxiety this year with COVID and changes to instructional methods. And we already know that our children did not get exposure to all the curriculum that would, be covered in a typical year. And it's stressful enough to sit down to a standardized test that you feel prepared for. But knowing that there's topics and questions that are going to be asked that you have not seen yet heightens that anxiety. And so I continue to advocate for legislation. I have a bill out that we're hoping gets a hearing to ask for a waiver this year. Teachers and schools have benchmark tests that have monitored student progress and better inform our teachers and decision makers as well as parents as to where their child is at any given moment during the year, better than a standardized test that's given in April or May and takes time away from instruction. So we want to give students as much opportunity to meet with their teachers, cover curriculum that they're going to need, and not to mention address mental health, social, emotional health. These are issues that our families and our communities are dealing with, and we don't need another layer of stress for data that we won't get until the fall that doesn't do anything to inform instruction now or next year. I think that covers everything on my list. Oh, I am a member of the Warren Centerline Prevention Coalition, and every month I meet with them. We address issues on education and prevention of alcohol, tobacco, and illicit drug use among our youth, trying to put preventions in place or increase awareness and services. And one of the tools the Macomb County Health Department brought to us is an online app called My Strength. It's an app you can, if you live in or work in Macomb County, you can download for free. And it is helpful to modify behaviors. And it addresses everything from insomnia, stress, anxiety, depression, to substance use disorders. It is free. It is available as part of a grant that they were provided that included they needed to provide the community a technological fix. Thank you, Sue. If you go to the chat, Sue put up the link to it. You can download it from an app store, but you can also set up your account from a computer or laptop at mystrength.com. She's plugged in that link, as well as the app access code. So it is free to you. You do need that code. So copy it down. you can share it. It's not personally, attached to you. This is your information is private. It is personal. You personalize it to what you need. It includes, mindful meditations and visualizations for calming. It includes stress tips on how to manage stress or other conditions, including, dietary considerations. If you're experiencing anxiety or insomnia, what are some things that you might want to pick up at the grocery store? Food as medicine. And so it's a great tool. I encourage you to check it out and live your best life. And with that, I am going to open it up to the floor. If you have something, let's either raise your hand or go down to the reactions at the bottom. And I want to hear from you. Lori Arts, come on down. Oh, your mic.
Figure this out.
There
All
we
right.
go.
I have a zillion things as usual. One, the city council talked on Tuesday that the law allowing Zoom meetings is expiring, and that city council will no longer be able to offer Zoom. Do you have any idea what the status? I'm very concerned, being a person with several underlying conditions. I would like Zoom to continue for another year. Also, I would like to see a hybrid, even though when we go back to in-person meetings, government meetings, I would like to see a requirement that they both be in person and Zoom be allowed as an alternative for those of us who don't feel comfortable being in crowded situations. Do you have any updates on that?
So the Open Meetings Act was waived by the epidemic order from MDHHS, which extended it to March 31st. So meetings can be held virtually for communities and still be in compliance with the Open Meetings Act. My indication from what I heard from MDHHS is that they expect a legislative fix in order for this to continue on. The legislature said that they want to have, more control, more oversight of any of these modifications. And I know of at least one bill out there that would continue it during COVID. And my understanding is that they can stream these meetings. However, under the Open Meetings Act, they have to be there in person and have to have doors open for the public to address. So MDHHS, with our numbers at the beginning of the month, had expanded in-person access, which was meetings could meet in communities where there's low transmission rates. They feel comfortable meeting in person, and that they have facilities that can accommodate at least 25% of the what is it called? The limits of who can be in a room are eligible, and if they want larger meetings, they can go to an auditorium and expand distance and space between participants. I don't know where this stands. It has not got a hearing, and we know that we will not be in session before this order expires. I have not heard from MDHHS whether they will extend it in an order, in the next couple of days. When I hear, you'll hear. And
are you saying, Lori, I'm sorry, I'm interrupting you. Does this mean that public meetings are no longer can happen after March 31st of next week?
What it means is that they would have to conduct it in person for the members of that body. So let's say city council or a school board, they would have to be present. and it would have to be open to the public. My understanding is that they can continue to stream it for the general public, but that cannot be the only method that is conveyed to the general public. Does that make sense, Lori?
Yes, it does. Thank you. I
Okay.
appreciate
So,
that.
so I would encourage, for a long time, our local school districts and city council offered, a cable streaming of their meetings, and then they also ran them and repeat later. But is that Sue plugging in? Thank you. Sue has the rules for school board and government bodies at the bottom, if you want to reference that law specifically. But reach out to those governing bodies and let them know that having a streaming option, increases community participation, and in the time of internet, that's not a heavy lift.
Thank you. Second, last month I talked about asking someone from Secretary of State to come and talk about our new kiosk and all the different features. There's two things I see on Facebook all the time that people are running up against a wall on, and one of them is Social Security. People don't know how to make appointments. People can't make appointments. People are driving without, I've seen repeatedly people encouraged to drive without an up-to-date driver's license and tags because nobody knows how to make an appointment with Social Security. And
Secretary of State?
Secretary of State.
Okay. Because Social Security isn't.
No. I said that wrong. Yeah, Secretary of State. People don't know how to do it. Then the second part of that is I am very, very, very upset with the Secretary of State's failure to push public advertising on the new law that's coming into effect in October. The normal everyday American does not understand that as of October of this year, you cannot get on an airplane, even to fly to Chicago, if you don't have a real ID. If you don't have a passport, you cannot get on an airplane this October. If you do not have a real ID, you cannot fly anywhere. If grandma needs to go see her sister's funeral in California in December of this year and she doesn't have a real ID or a passport, she cannot get on an airplane. And Secretary of State has failed to make sure that the Michigan citizens understand that fact. I, for one, have both a passport and a real ID, but the average Joe, just saw yesterday the person saying they don't want a real ID because there's no reason for having one. People don't realize this law is a brick wall.
Okay, let me unpack that, Lori, because you got a lot going on. Did that cover the list for Social Secretary of State?
Yeah, yes.
Okay, I got it all. Okay. So we are reaching out to the Secretary of State's office, and we're looking at doing it as an add-on to one of my community conversations, perhaps in April, which would be Saturday, April 24th. I'm not sure that it goes to the point of doing a whole roundtable with it. So we're going to start there to give them an opportunity, a platform to explain some of those online kiosk options for people to ease that. I'd have to look at the emergency orders where we're at, but the Secretary of States are open. People need to be planning ahead on birth dates and renewals. And while you can renew a lot of things over the internet, if you have like a photo that needs to be renewed with your license, you need to plan for an in-person meeting. It isn't as difficult as people were encountering making those appointments, but I really strongly encourage people to be flexible. Plan ahead so you have the option of driving 10, 15 minutes to maybe a Secretary of State that isn't as busy, but might not be your corner Secretary of State go-to. So there are quite a few offices out there, and not all of them get the same level of traffic. If you're willing to go on and be flexible about where you go, it's a little bit easier to get an appointment. So plan ahead, look around, and be flexible. But you do need to have your tabs. You do need to have your driver's license, and you don't want to be put into a difficult situation because of that. So real ID. So when Jocelyn Benson, our Secretary of State, took office in 2019, there was a huge push 2 years out to make sure everybody knew that they had 2 renewals where you had, could go into the Secretary of State's office, bring your birth certificate or another document which would verify your U.S. citizenship, which would verify your ID as a real ID. And we also need to clarify between a real ID and an enhanced driver's license. I think a lot of times people think that this is asking them to make their driver's license an enhanced license, which would allow them to cross the Canadian border with their driver's license instead of a passport, or to get onto a cruise ship with their driver's license instead of a passport. That's the enhanced driver's license. And that's not what we're talking about. You can still ask for enhanced driver's license because of the convenience of, once the borders with Canada are open, being able to participate in, vacations and, business and go shopping or go for a visit. The enhanced driver's license can be nice and convenient, and not having to have 2 documents. Whereas the real ID is that verification of citizenship that, as Lori was pointing out, you need to be able to fly. And it's as simple as bringing a birth certificate or other eligible documentation with you when you renew your driver's license. But again, making sure that that's there. So ahead of COVID-19, there was a really strong push and making sure that people were aware. We incorporated it into several of our community conversations. But unfortunately, with COVID-19, a lot of resources went there. And you're right, it's kind of fallen off the radar. And we'll do what we can. I'll do what I can to promote that, because we have till October. I know without more restrictions on flying and not wanting people to move COVID around the country, that's kind of been on the back burner. I don't know that that's the Secretary of State's priority right now, but I will try to raise it with them and let them know that we need to make that more visual, more knowledgeable. And we're still renewing driver's license, and we want to make sure that we have the documents we need. Kiosks, lapse tabs, making appointments, real ID. Did that cover it all?
Yes, thank you, Lori.
Okay. And I'll push it out. Let's see. Thank you. So my intern Nathan posted to me in the chat that when you travel and you go to DT Metro airports, that's what the announcements are. And if you have your driver's license and you're getting on a plane, you might be thinking, I'm good. Does this announcement pertain to me? But what you're looking for, I don't have my driver's license handy. And I believe it's like a little gold star on your driver's license. That means that this is real ID and covers it. Thank you. Thank you for that, Lori. And I will try to use my platform to help raise awareness on that as well. Wesley, thank you for your patience.
Okay, can you hear me?
You're good. Go ahead.
Oh, good. My wife doesn't tell me I'm good, but anyway, that's all right. Hey, first of all, thank you very much, Lori, for your wonderful work. We love you. We are so thankful we have you serving us. It's so nice to have a good person in that office. Not that there was anybody bad in the last 10 years. There weren't. There weren't. Both Paul and his wife and come on. Yeah. I can't think of his name. Okay.
Rep Green. Yep.
Yeah, we're all very good. Thank you. I have about three things. Just a really short note, which is not really part of us. Heard on WWDay's news yesterday. When you do your taxes, double check your unemployment now is exempt for first $10,000. Supposedly, I'm not saying it's official, and Michigan is supposedly going to follow up. Not official, just mentioning it. Anybody doing their taxes, that, by the way, that's been extended. Double check that before you necessarily pay them a lot of money. So
yeah, let me just put the shout out.
Go ahead.
What would have been tax day was April 15th. Again, we have an extension this time till May 17th. Gives you a little bit of wiggle room. But as they say, don't wait till the last minute. And thank you for bringing that up. You are absolutely right. That first $10,000, and some of you who are or have collected unemployment in the last year have had those taxes automatically deducted, so that you don't get hit with a big tax bill come April or May. And so you might get a nice little refund there, but keep an eye on that. Thank you for waiving that, Wesley.
Also, just want to mention this shortly. Corporations doing business in Michigan. Hey, these guys ought to be paying taxes. Yes. I know that's difficult. I know you got to lobby. You've got to fight. You're going to have to get a suit of armor, Lori. To fight.
Well, if you look at my voting record, Wesley, I'm with you. Not that I want disproportionate taxes. We do want Michigan to be competitive with other states. But when corporations pay taxes, they fund our schools, they fund our local government, they help make this state go. And all the services we have to be paid for. So anytime we give a tax break, we're foregoing services or adequately funding services. So I really scrutinize. I understand that people want to incentivize bringing a business to their community, to bring jobs or opportunities. But like we just offered, the Republicans offered up broadband taxes for some telecom businesses to set up broadband in communities. I said no, because those, not because I don't support broadband. I would like broadband to, perhaps exist as a utility in communities where it is not adequately offered. But that the telecom companies, without a guarantee of what level of providing, just giving them, corporate welfare, giving them a tax break for no guaranteed service. I'd look a little closer if they said we would provide this many providers with this much service. I would look at what we were gaining with what we might be trading off. But thank you for raising that.
Last of all, keep up your fight against the robocallers and telemarketers. We are so many people. I tried to organize those reunions a couple of years ago. I tried to call 200 people, my classmates. People are afraid to answer the phone, and they're even afraid to get pick it up and see who's there. Folks, get an answering machine or get voicemail so you can get your emergency calls. And Lori, keep up your fight against the robocalls and telemarketers and the bots. It's being done by bots. The bots are coming. That's all I have. Thank you, Lori, for your good work. Thank you very much.
Thank you for putting it on my radar again, Wesley. After we had that conversation last month, I did some research, And the Attorney General was doing some really good work around this. I believe I shared out the article with you. But again, it's something that we need to be informed of how frequently this is happening, where it's happening, what is the hook, what is the lure, what are they trying to tell you. There was a big phishing scam telling you like you had to you weren't getting access to your credit card, you had to confirm your information. I got a couple of those emails and I said, no way, there's no way I'm hopping on a website. I called the line for my credit card company. I said, is there information you don't have from me? And they said, no, that was a scam. So anything that doesn't sound right, pause, go directly to the source that you know to be trustworthy before you give out public information. And if you are getting these scams, please reach out to the Attorney General's office. Make sure they know how frequently, where it's coming from, and what is the target so that they can then tailor their investigations to it. So thanks again, Wesley. Keith, I'm not sure, is that an applause?
Yeah, no, it's hit the reaction just like Lori did, Lori. So I could have a few comments like Wesley did.
Yes.
You are correct about the Real ID. It is the gold star. And something I learned a week ago yesterday, I took friends to the airport and she had the global entry, which puts you through the TSA pre-check. And if you're going to do international travel, you bypass customs. It puts you, it's just good information. If you're a American Express, Sky Miles, if you got that credit card, you just go to the Trusted Traveler program through the Customs Border Patrol. I applied that Friday. I have that credit card. I went down by Ambassador Bridge to do my interview this past Monday, and I'm approved. And you get it's $100 fee you put on your credit card, and then you get a credit card statement. And that's good for 5 years. And whenever you check in, you get the TSA pre-check, whether you're doing domestic or international travel. So that's just good information for people. And
yeah, I have some family who travels for business and they avail themselves of that. It is an added fee. It is added scrutiny, background check. You have to submit additional documentation and, like you said, appear for interview. But it does, it's a trade-off. It gets you through some expedites TSA security. So I appreciate you throwing that out there, Keith.
Right. It was amazing. When you're on their website, they're trying just to have you do the TSA pre-check option. But I want to do some international travel in the next, who knows how many years when this pandemic gets over. And for the extra $15, they said it could take up to 90 days. It took me 3 days. So I think they're just not busy because of the pandemic. So that's just their normal website. And then the other comment, since you and I talked last, well, not the other, I got another thing after this. My unemployment, still I haven't heard from anybody. I will try to reach out to them again. I received a letter from them saying my extra 7 weeks is no longer valid, but I still qualify for the 11 weeks. But I'm not getting any certification. I check it daily, and they say I am eligible, but I'm not getting anything on my WHAM account. So.
Thank you. Yeah, because we've worked with you in the past, Keith, to iron out some of those missing weeks.
Right.
And we know that anytime that they adjust the system, there's hiccups in the system. So I'm just going to have you email me at my office that we can look into it at house.mi.gov.
Yeah, I'll use the same email address I did last time I emailed you about this last month. I'll do that, Lori. And the last thing, it sounds like it's over. I know the last conversations that I was in, you were talking about the Beaumont diversity donations, and I was going to try to help by going to the city halls, and since I'm a volunteer at Beaumont now to deliver anything, but it sounds like that's all over now, that program.
Yes. So Treasurer Barnwell She worked out with the community. She got a couple extra donations, so they kept their box a couple extra weeks, and she just took it over
Yep.
herself.
Yep. She's right
personally.
there, so that works. So,
Yeah, but I appreciate the offer and I appreciate the support.
yeah, very good. And that covers it for me. And originally, I didn't think I was going to be at this meeting, but I'm glad I was able to make it. So,
Well, and you brought there is a hunt and fish mailing that is
I
going
received
out
it yesterday. Yes, that was
Get
good.
it? It was in
Yes.
my mailbox yesterday. So if you have a hunting license or fishing license and you live in House District 28,
Yep.
I sent out a mailing with
Yep,
the
I received it.
updated list of prices for renewing your license, along with some updated DNR information that may have changed since last season. And so I encourage you to take a look at that. If you do not currently hold or have perhaps a lapsed fishing or hunting license, we have a few extra prints of that mailing that we could send out to you. I also keep them with a few extra copies with me, and we have them in the office. So if you're looking for that document, or if you know someone in the community who is, feel free to reach out to us and we can send you a copy of that.
Yep. And that's why I originally didn't think I'd be at this meeting, because part of that was in your handout pamphlet, was about the food plots. I was going to be up working on my food plots this weekend. So that's going to wait till April now. So
I know our fishermen are chomping at the bits.
Yep.
And people are looking at, what hunting, seasons they can avail themselves. We know with COVID, hunting and fishing are great outdoor recreation that people can participate in safely. And so I strongly encourage it.
Yep. Thank you very much, Lori.
Who else, who haven't I heard from yet that has something, a question, a concern, or questions about what was shared? Well, it is 11:52. We're approaching noon. I appreciate your time. I will stay on another couple minutes if people want to still reach out and ask an issue. But thank you so much for joining me this morning. And I just want to put on your radar, Saturday, April 24th at 11 a.m. We will do this all again with the latest updates from Lansing and what's going on in the community. Have a great weekend, everyone.
Thank you, Rep.
Thank you again.
Thanks, Wesley. Take care.
Lori, I have one question, if I may.
Go for it.
I had asked you about this previously. Who is responsible for cleaning up the trash on 696? Is it the state, is it the county, or is it the city of Warren? I drove through yesterday. It's disgusting. There is trash all over the place. I think it's the county.
Thank you for raising that again. For some reason, I did not follow up on that, Lori, but it is on my list and I will get you an answer.
I would very much appreciate. Well, I would like to start making phone calls because we have foreign visitors. We do it even now. We need to clean it up. So
interstates are generally MDOT, Michigan Department of Transportation, and not knowing that would be my first call. Is find out who's responsible for the berms on the side. If it's specifically 696, as you get to other roads, I'd have to look at which ones are, city versus county. But if it's specifically 696, let me look into it and get a definitive answer.
Okay. Thank you very much.
Yep. Thank you, Earl. Did you have any problems? You're on mute. Can we unmute you?
Yeah, I can do that. I'm sorry. Okay, may not be till Monday before I get this posted. I'll post you over a link. Okay, I got a lot going on the weekend. I've lost 2 rooms out of the house because of water damage for over a month. Yeah,
Oh
I'm
my
sleeping
goodness.
right here. Yes, ma'am. So I'm trying to get people in to repair it and so forth. So we will get back with you. I'll try to get this up by Monday. I got to miss the contractors to call. See ya. Have a great week. Thank you for your work.
Thank you. Take care. Save chat. Folder.